Hello, everyone. Can you guys hear me? Oh, thank you. So welcome back to our OET session. My name is Dr. Anushree Chandra, and I'll be handling the speaking subtest today. So welcome to Aspire Education OET. These are our social media handles. If you have any queries or if you want to reach out to us, you can do so on the given email. That is oet@aspiretoplab.com. You can reach us on our dedicated WhatsApp group. The number is shown on the screen. +91 81 05 966 999. And we have a dedicated website that is the oet.aspiretoplab.com and the www.aspiretoplab.com. We're even active on Facebook and Instagram on the given handles. All right, let's begin the session by taking a look at the format. So the basic structure, this was discussed in the previous introduction class, but we'll be going in depth this time. So OET subtest, the speaking subtest runs for 20 minutes, and the topic is specific for the profession. So it's usually a simulated interaction between a healthcare professional and a patient. In this case, the patient will be the interlocutor. So this measures your ability to communicate effectively and appropriately in a medical healthcare workplace context. So let's take a look at what happens the minute you enter the test room. Your identity and profession is checked, and then there is a 2 to 3 minutes of warm-up conversation. This is never assessed. So during this time, the format of the test is explained. The candidate is helped to relax, and questions about areas of professional interest or previous work experience or future plans are asked. And this is followed by the first role play. The interlocutor hands you a role play card. So it's from this point onwards that you will be assessed. So you will be given 2 to 3 minutes to prepare, and the candidates can ask questions during this time. For example, if they don't understand the meaning of a certain word or say the question per se. And the role play is conducted for approximately 5 minutes. And once the first role play is done, you will be handed a second role play card. Again, this is assessed, and the same procedure is repeated, as in you will be given time to prepare for 2 to 3 minutes, and then they will start your role play. So let's take a look at the sample paper so that we have a better idea as to what we will be dealing with today. Right, so in the role play card, the setting is usually given as in, it's important for you to know if you're in a hospital setting or it's a home visit. And then your task will be on the bottom side of the role play card, and it will be explained neatly as to what you should do and what is expected of you and how to go about the role play. So this is a nursing sample test. All right, so let's see the role of the interlocutor. All right. So the person you speak to in the test is the interlocutor. They're only there as a communication partner. So what initially happens is that the interlocutor will tell you their name and invite you into the test room. And if in case your role play says that you have met this patient prior, or say this is their second or third visit, then you can use this name given by the interlocutor for your role play. All right. During the preparation time, as I've mentioned earlier, you can ask any questions that you have or any definition or meaning of words that you don't understand. The interlocutor will tell you this. Please always clarify. So in case you do not get any, say you're not able to follow the interlocutor or they're too fast for you, you can always clarify. You can ask them question. You can confirm if that's what they've said. And vice versa, if the interlocutor does not understand something you have told them about their treatment, they will ask you for clarification, just like they would in a real hospital scenario. So the interlocutor's language. They won't be a native English speaker. They will be somebody from your place, but they will have really good English and they will make sure that you can understand them. They will not be too fast or too slow. They will be easy to follow. All right. So the next point, indication of your grade. So the interlocutor will record your role plays and your role play will later be assessed by two other professionals from OET and they will give you your assessment. So the interlocutor is not trained to assess you, hence they will be not giving you a grade then and there, and neither can you ask for it. So what happens in this role plays? So you will be given a role play card and it looks something similar to the sample. All right. So we were talking about the role plays. So you will be handed a role play card and you will be given 2 to 3 minutes to go through the role play card and prepare and to take down notes. So during this time, please go through the role play card carefully because there is a certain set of tasks that you will need to be able to perform or you should try to complete within the 5 minutes. So this role play card will be given to you throughout the task and you can refer to it whenever you want to. But at the same time, please make sure that you don't keep looking at the role play card and make the patient feel ignored. So the assessment. Your role play will be recorded and as I mentioned earlier, it will be assessed by two professional OET members. And yeah, regarding notes and questions, you can write down notes during the preparation time. And if you have any questions, please make sure you clarify them during the preparation time and not when the role play starts. And please remember that OET is a test of English language skills and it is not a test of professional knowledge. Now, having said this, you might have a few questions saying, if the task needs you to tell the patient about a management plan or address concerns, or you need to discuss a topic in detail. These things will be, sorry, so you don't have to exactly know how to go about them because in the task, you will be given prompts. You will be given, say, keywords as to what points you should mention. So you don't need to know the management per se because they will mention it in the form of notes in the role play card itself. So just make sure you cover those. Now let's look at a few do's and don'ts. All right. So what should you do? Take charge of the role play. So even if the patient is quiet, say they don't want to respond properly, it's okay. Probe and ask. They're assessing you. So make sure that you open the role play and you come to a natural conclusion and you end the role play. Respond according to the situation. In the task, they usually mention as to if the situation is serious or if it's just if they just want to know the details, or if they want to know, like, you need to find out the main purpose, and you need to see how critical the situation is and respond accordingly. Don't try to squeeze in say a few more sentences, or just to show that you know the language. Always be responsive, be empathetic when you respond to the patient. Make sure the patient does not feel ignored and that you're paying attention to them. So refer to your card occasionally, just to make sure that you're not leaving out on any details or any questions that they want you to address. Do refer to your card occasionally. Please do not use scripted phrases. So it is quite natural sometimes, when we don't know how to address a case or a scenario, we try to go through examples and try to imitate them. Well, going through these phrases is good, but the more you go through them or the more you try to by heart, you try to replicate the same sentence. And they don't want that, because the minute they feel it's scripted, uh, well, it won't be right. So please do not memorize what's on the role play card, because naturally it's in your hand. You can look at it anytime you want. So there is no need for you to actually memorize the role play card. Do not rush through your preparation time. You will be given 2 to 3 minutes. Even if you finish within 30 seconds, do not tell that you're ready and you want to go ahead with it. Please take your 2 to 3 minutes. Try to organize what you want to ask. Try to come up with a method as to how to go about the role play. And even if you've completed it earlier, it's all right. Just wait, take a deep breath, and wait until your 5 minutes starts. So do not plan in advance. Again, don't do this, because the minute you make up sentences in your mind and you want to put all that out there, you're not responding to the patient's emotions. You're not being empathetic. Do not rush through the task. So it is natural sometimes that you get scared, and you might think, will I be able to finish this task within 5 minutes? There are so many questions that I need to address. There are so many concerns. But do not worry. It usually takes a very natural role on its own, and usually comes to a gradual end within those 5 minutes. So you will be able to cover all the questions that you've been asked to address. I've noticed a few other candidates who think that, what if I'm not able to finish all the questions or the task that is given on the role play card? It is okay. You do not have any negative marking for this. Even if you're not able to finish, say at the end of 5th minute, the interlocutor will tell you that your role play has come to an end, and you don't have to worry even if you haven't been able to cover a few questions. This is a very important aspect. Make sure you clarify your answers during the speaking test. So there are several useful expressions that can help you clarify. Say if you want to check if the patient has understood you, or if you haven't understood the patient properly and you want to re-ask the question, it is okay to do so, because this is what you would do in a natural workplace setting. And we have provided some examples here. If you want, you can read through it. I will read it for you. So clarifying expressions like, sorry, please can you explain what you mean by so-and-so? Or can you tell me more about ABC? If you want to check if you were understood properly or by the patient, you can always summarize, or you can try to put it in a brief form. Like, for example, say, to recap what you've told me, and then you can, what do you say, summarize the entire situation that the patient has in short. Or you could say, thank you, but I just want to check if I've understood you correctly. So to summarize, so and so. Again, please do not by heart these statements. This is just to give you an example, just to give you an idea. Have you guys been able to follow? Let's just take a quick recap moving forward, because next is our assessment criteria, and pretty sure it's a lot to digest. So yeah, so this is what we discussed so far. The format, the time, the topic, what is assessed, what is not, who assesses and who doesn't, the role of the interlocutor, so the questions and the clarification. And yes, let's be clear, they're not going to grade you. So the role play. Now we know how a role play card looks and how to go about it. You can take down notes in the introduction and how it's assessed. I'm sure you guys remember that your role play will be recorded and played back and assessed by 2 individual OET characters. So we went through a few do's and don'ts, and yes, always clarify your answer in case you don't understand something, or in case you feel the patient hasn't understood something. You can always repeat. Let's look at the assessment criteria. So what is usually assessed? Let's say, like, generally speaking, what is assessed is that how you handle the patient. Say, if you're explaining the medical condition or treatments and terminology in an accessible way, which means that you're using layman terms. You rephrase ideas and opinions in different ways to try and convince a patient. Suppose you have a difficult patient. They want to know if you were able to successfully get your point across. So how is speaking assessed in OET? There are 2 major criteria, the linguistic criteria and then the clinical communication criteria. So the linguistic criteria carries 6 marks each, and the clinical communication criteria carries 3 marks each. And to get a B grade, usually it is advised that you get 5 out of 6 in linguistic and 2 out of 3 in the clinical communication criteria. All right, so what does the linguistic criteria contain? Intelligibility, appropriateness of the language, resources of grammar and expression, and your fluency. So in the next few slides, we will go into the details of these. All right. So what is intelligibility? It's about how clearly you can be understood. It refers to your pronunciation, intonation, stress, rhythm, and accent. All right, let's look at the first point, the sentence stress. Sentence stress and word stress are basically is when you use a natural flow of speech and you emphasize a certain word to indicate the meaning or seriousness of the word, or in a sentence, it would be to emphasize on the information. So whenever you stress on a single word in a sentence, is this is to show how important it is, basically. Intonation. So show control of intonation. Intonation is nothing but your natural rise and fall of your voice, and the force or the length, and again, emphasis on the word or sentences. to enhance the meaning and strengthen the communication. Linking words. So to show the ability to link words together naturally, for example, there is no space when you say in an hour, but if you say in an hour, that's not right. So pronunciation. Please pronounce words clearly. For example, worry, worries, worried. So make sure the consonants are clear so that the patient or the interlocutor does not get confused as to what you're saying. Another example, pill and bill. All of us, have this natural rhythm and accent that is usually influenced by our mother tongue, but please try to minimize this because this can also affect your pronunciation. All right, fluency. What is fluency? Fluency is nothing but how smoothly your speech flows or the speed of your speech. So, number one, speak at a natural speed. So, maintain a natural speed, as in not too fast and not too slow. So, not giving way too many gaps between words or sentences, and not blurting out chunks of words or information at one go. Even speech. So, please limit hesitations in the speech, as in your say sentences or your conversation should flow smoothly. Natural pauses. Use pauses appropriately. For example, say to make your meaning clear, or again to emphasize on something to show that it is important. Um, all right. So natural fillers. So fillers. Um, all right. There is another slide in the future, I mean, a few slides after this, where I can give you the complete meaning and examples of fillers and back channels. It's kind of useful to know about this because fillers are nothing but the and these sounds. So try to avoid them. It's not wrong to use them. You can use a few, but don't use it constantly after each and every sentence. And also, please avoid restarting sentences or repeating words again and again or correcting yourself. Say if you've made a mistake, if it's not too late, correct it if you can, but if you've already moved on, then don't go back to the previous sentence and then say, oh, I'm sorry, I made a mistake, and then try to rephrase it or re-say it to the patient. Because I mean, you'll never know. They might have not heard you at all, but the minute you actually get attention uh, to those sentences and say that you've made a mistake, so you're basically telling them that, yeah, you've made a mistake. So try not to correct too many mistakes. If you've made a mistake, it's fine. Just move on. Like, don't keep correcting yourself. So, resources of grammar and expression. So it's about your ability to use a range of grammatical structures and vocabulary, as well as your ability to use them correctly and appropriately. Range of structure and vocabulary. So, yeah, sorry. So the range and accuracy of the language resources the candidate has applied in the performance to convey a clear meaning. So a strong proficiency candidate will include appropriate structures of what he or she is saying, and you got to be cohesive. Of, for example, say you want to tell them 2 or 3 pieces of information. You can label them saying, firstly, let me tell you about so and so, and then secondly, and then to conclude. So you can try to make it look, I mean, you can try to make it look natural. So variety of phrases, show that you can use different phrases to communicate the same idea. Try to use different words, try to be clear in what you're saying. Question formation. Form questions correctly, particularly those questions that are often used in health professional or a patient dialogue. Like, how long have you been experiencing this? Instead of, how long? So minimize grammatical inaccuracy to enhance communicative effectiveness, as in show, say, accurate control of grammatical features like correct use of pronouns, conjunctions, and word choice. I'm sorry, I don't think I covered this slide. All right, appropriateness. So appropriateness is about your ability to use suitable professional language and explain things to patients in a simple way. It is also about your ability to communicate with patients of different ages and background. So a simple example for this would be not using medical jargons and trying to use normal spoken English phrase instead of trying to get your medical terminology across. So yes, number one, use non-medical language. So if the person can understand the medical language, it's fine, but it's in case you do use it, please make sure that they have understood the term. If not, please put it in layman terms. Or to be on the safer side, you can put the whole thing in layman term so that you're clearly understood. Age and background appropriate language. Make sure the language you use is suitable for someone of the patient's caregivers or the caregiver's age. Professional language. Make sure the language you use is suitably professional and appropriate for the situation. Confirming question. Consider asking questions to ensure that you have understood the patient and that the patient has understood you correctly. So clarifying is one of the important factors and you should not forget about it. So let's look into the clinical communication criteria. Each of these is marked for 3 and you will have to get a 2 to get a B grade. So it includes relationship building, understanding and incorporating the patient's perspective, providing structure, information gathering, and information giving. So here are a few tips for good clinical communication. Number 1, build rapport. 2, be patient-centered. Try to know what the patient wants, what they have come to you for, and please try to provide those answers. 3, listen actively. So you should always make sure that the patient thinks that you're equally interested in what they are telling you. And a very simple way to do this, for example, is say they say, they give you a piece of information, you can always repeat it back to them. So that kind of shows that you've been listening and following the patient's perspective. Always try to know the patient's concern or ideology or what he thinks of the situation, so that managing the case becomes easier for you. Open and close-ended question. So when you're gathering information, you should always ask them open-ended questions. And if you're trying to know the specific answer to something, or you want to know a specific information from your patient, you ask them a close-ended question. So sorry, yeah. So topic changes. So when you're changing a topic, please try to label the sentence. Say that you will be asking regarding their lifestyle before you ask them about their diet or smoking or alcohol intake. It's also called signposting. Link to the purpose. So link what you say clearly to the purpose of the communication. Structured communication. Take the lead in the consultation, organize the talk, and clearly indicate the organization to the patient. So what are the indicators of a good relationship building? Initiating the interaction appropriately. That is your greeting and your introduction. So this helps establish the rapport and a supportive environment. Initiation involves greeting the patient, introducing yourself, and trying to cross-check the patient's name, and to clarify your role in their care. The nature of the interview can be explained, and if necessary, negotiated. All right. Demonstrating an attentive and respectful attitude. So this establishes trust with the patient. It lays down the foundation for a collaborative relationship and ensures that the patient understands your motivation to help. So examples of such behavior would include attending to the patient's comfort, asking permission, say before you carry out an examination, but you will not have to do this in OET speaking, but yeah, in general, like asking permission and consent to proceed, and being sensitive to potentially embarrassing or distressing matters or questions or details. So yeah, demonstrating a non-judgmental approach. Accepting the patient's perspective and views reassuringly and non-judgmentally without initial rebuttal is a key component of relationship building. A judgmental response to a patient's ideas and concerns may devalue their contributions. So a non-judgmental response would include accepting patient's perspective and acknowledging the legitimacy of the patient to hold their own views and feelings. Showing empathy for feelings or their emotional state. Empathy involves the understanding and sensitive appreciation of another person's predicament or feelings. So this can be achieved through both nonverbal and verbal behavior, such as use of silence when they are telling you something sad or something serious. And verbal empathy includes more, it includes you specifically naming and appreciating the patient's emotions and predicament. All right, here is a little task to check if you guys are awake and following me. Complete the dialogue keeping in mind the criteria on relationship building. So here is the question. So it's on the screen. So the medical professional says, "Good morning. My name is medical professional X, and you must be Jack's mom. Is that right?" So the parent says yes. So the doctor says, "And this is Jack?" And the patient says, "Yes." "Great. Well, let me introduce myself." So what do you think his introduction should be? You guys could type it out in the question section, or you guys could just write it down and cross-check when I give you the answer. I mean, there is no one particular way to go about it, but make sure that you're open and positive. I can see a lot of questions. I will be answering all of this at the end of the session. So does anybody want to type in the answer? Yes. All right, we have a response. "Hi, Jack. I'm Debbie, and I will be Very good response. Anyone else want to try? All right, let's take a look at the answer. So, I'm one of the medical professionals at this clinic, and your regular doctor has asked me to talk to you about your son Jack's feeding issues. So, actually, I haven't given you the whole scenario. Maybe, yeah, that's why this detail is at the moment too much. But yes, make sure your introduction is simple and clean. All right, let's look at the indicators of understanding and incorporating the patient's perspective. All right, eliciting and exploring patients' ideas, concerns, or expectations. Like I've already told you, please make sure that the patient gets to know that you are giving them attention, that you're actively listening to them, and be empathetic. So, understanding the patient's perspective is one of the key components. Each patient has a unique experience of sickness that includes how they feel and their thoughts, their concern, how they think it's affecting their life. So please make sure to ask them regarding all of this. Picking up patients' cues. So patients are generally eager to tell us about their own thoughts and feelings, and often do so indirectly through verbal hints or changes in nonverbal behavior, such as hesitation, showing hesitation, or change in volume. So pick up these cues, try to explore as to what is bothering them. And yeah, like I could give you a few examples regarding that. So you can, as I've already mentioned earlier, you could repeat back what has been just said, or you could say, is there anything that could be done regarding it? Like in case it is not related to the case, then you could say something like this. Or you could say, "I sense that you're not happy with the explanation you've been given in the past." Try to be empathetic. It's very important. Relating explanations to elicited ideas, concerns, or expectations. So if the explanation does not address the patient's individual ideas or concerns, uh, understanding and satisfaction, understanding and satisfaction suffer as the patient is still worrying about their still unaddressed queries or concerns. So always do ask them if they want to know about anything more, or if their concern is addressed. So here are the indicators for providing structure. This might seem like a little too much information, but you don't have to necessarily remember all this. This is just for you to know, so that when you address the speaking task, you'll have all this in your minds. Like you'll make sure that these criteria are fulfilled. And this will come naturally once you start practicing a task or two. So you don't have to exactly remember each one of these by heart. So what is the indicator for providing structure? Sequencing the interview purposefully and logically. So this is very important because this is one of the major things that they assess you on. So it is the responsibility of the healthcare professional to maintain a logical sequence. So an ordered approach to organization helps both professional and the patient in efficient and accurate data gathering and information giving. So this needs to be balanced. And how do you do this? By being patient-centered and follow the patient needs. So instead of aimlessly jumping from a point to another, you could start addressing their concerns first, and then you could give them the information that you want to give. So signposting changes in topic. So I think this comes under another criteria as well, because I just discussed about it. So whenever you're changing a topic, it's always good to signpost so that you don't take the patient by surprise. They know what you're about to ask them, and even their mind will be well prepared to give you those answers. Using organizing techniques to explain. So I could give you examples of this so that you understand this better. So it's like, when I say we will address that first and then move on to your other symptoms, like, is that okay with you? Or could I start by just asking a few more questions about the joint pains, and then we can come back to your difficulties with the children? So what exactly happened in these two examples is, in the first one, in the first one, you were trying to say you were trying to address a symptom that was more important and that needs more explanation. And even in the second one, it's the same. So whenever the patient says that there are 2, 3 concerns and say it is not related to your case, always tell them nicely that you will come back to it once you're done explaining what you have to tell them. All right, so we have indicators for information gathering. So all of these comes under the clinical communicative criteria. So hang in there, guys, just another point regarding the assessment. All right, facilitating patients' narrative with active listening techniques, minimizing the interruption. So whenever a patient is giving you the details, don't cut them in between. Let them tell you what they want to tell you. Let them complete their statements. And whenever they are giving you long chunks of information, just to show them that you're following, like just try to repeat the last 2 words of what they said, like, all right, so this what happened, or just small phrases like those that show that you're actively listening to them. Using initially open questions and appropriately moving to closed questions. So like I already mentioned earlier, in the beginning of your case note, you will be asking them a lot of open questions because you want to gather information so that you can come to a natural conclusion. You can tell them the management plans, and you can complete your task towards the end of it. So naturally, once you begin with open questions and you gather a lot of information, you can go into close-ended questions regarding one particular bit of information that they have given you, something that will help you, say, in your management plan. Not using compound questions or leading questions. Make sure that your questions are short and don't directly get into the topic. Say, the minute you open up your conversation, your role play, excuse me, do not directly ask them, did you do this, or did this happen? Did you experience this? These kind of yes or no questions, try to avoid it or try to keep it to the end. But definitely don't ask these in the beginning of your role play. Clarifying statements which are vague or need amplification. As I said, in your real work life scenario, you would always clarify something if you didn't understand. So this role play is no exception. You can do the same thing. In fact, if you do that, it sounds more natural and not practiced or rehearsed. So summarizing information to encourage correction or invite further information. So summarizing is the deliberate step of making an explicit verbal summary to the patient of the information gathered so far, and is one of the most important of all information gathering skills. So it is used periodically throughout the interview. It helps with two significant tasks, that is, ensuring accuracy and facilitating the patient's further responses. So this is the last point in clinical communication skills, information giving. So let's look at the indicators. Establishing initially what patient already knows. It's always good to know what the patient's ideas or idea about the condition is, to say, to rule out any doubts or to give them more information and to make sure that they know what is happening to them. Pausing periodically when giving information, using response to guide next steps. So say you break a bad news. You can't break the bad news and then immediately say, this is what we're going to do next, or this is how you're supposed to go about it. When you break a bad news, give a minute of silence, like give a pause, so that you show you show the patient that you're being empathetic, and to show that you're more understanding. Encouraging patients to contribute reactions or feelings. This is again very similar to you trying to know what they think of the problem. So checking whether patient has understood the information. So this is a very important step, ensuring accuracy of information transfer. So this can be done by asking, does that make sense, or do you follow? And although many patients will say yes when they mean no to avoid looking stupid, just make sure that they have clearly understood you. So a more effective method is to use patient restatement. That is asking the patient to repeat back to the doctor what has been discussed to ensure that their understanding is the same. So that way, even you're sure that they have heard you and they understand you and they know how to go about this. Discovering what further information patient needs. So deliberately asking the patient what other information would be helpful enables a health professional to directly discover areas to address which the health professional might not have considered. So sometimes what happens, when you're in that hurry to say, finish the task, you might skip on a few points. So when you ask the patient, like, did I leave out anything, or do you want to know about anything else? Uh, you might actually realize, I mean, if you have skipped out on anything, you might have actually realized that you've skipped out on that point, and then you can give them that information. All right, now that we are done with the clinical criteria, let's look at a few test skills. So basically, what I'm about to tell you next kind of makes all this information compact, and basically this is what you need to bear in mind at the end of the day. Like, even if you forget all of that points that I just told, it's okay, but do make sure that you have these test skills, because at the end of the day, they're first checking your grammar. All right, what test skills do you need? So active listening, as I mentioned, use of silence and pausing whenever you're delivering a serious uh, diagnosis, or you're about to tell them something delicate. Back channeling, that is, whenever a patient is talking, don't just sit quiet without any reaction, because this might give them a doubt if you're listening to them or paying attention. So use verbal feedbacks, like it is okay to use or I see, all right, and words like those to show that you're actually listening to them. Echoing and repetition. This again is what I said, like when they end a sentence with a piece of information, just say the same thing back to them to show that, yes, I was listening and I know what you're talking about. So paraphrasing and interpretation. So you can say, oh, when they say, the pain's been getting worse. Oh, so it's been getting worse, is it? So you can just, I mean, not after each and every sentence, but every once in a while, just to show that you're listening to them. And this actually makes your talk more engaging. And yeah, it strengthens the relationship between the speaker and the listener. So as I promised, so fillers and back channels. They're really important for you to know. And at the same time, you should know when to use them and when not to. And you should also not use them too much. So fillers and back channels are common in spoken interaction because they serve important communicative and interpersonal functions. So what are fillers? So fillers are like, as I mentioned, like they're words or utterances or sounds like mm, and uh, they don't have a specific meaning, but they fill pauses and allow the speaker more time to decide what to say next. And back channeling, it's the feedback given to a speaker while they're speaking. So yeah, here are a few examples of back channels. Like, really, is that right? Do you, or are you? All right, here is another small task. So which among the following are fillers and back channels? So I'll just put up the answer. So as I said, the fillers are all these sounds and the tiny little words that you use to fill in gaps. And these are the back channels, just to keep the talk engaged and to keep it going. All right. Now, what is the kind of language that you need, or that you need to be aware of for the speaking module? Yeah. So natural expressions. Native speakers tend to use a set of phrases and expression in certain contexts. So let me give you a few examples of those. Like, yeah, for example, yeah, in the medical context, there are certain ways to express ideas that are idiomatic and natural. So these natural expressions tend to make the interaction between the two speakers less mechanical and much more friendly. So you will get to know what I mean. Okay. So here's another tiny task. Hopefully the screen is visible. Yes. Um, so these are natural expressions. For example, a flare up or blackout or burnout, checkup, and when you say out of the blue, it's better to use these terms instead of uh, using medical terminology or our medical definitions. So anybody want to? Is there anyone who wants to enter the answers? No, no one. So a flare up would be a sudden worsening of a health condition. To black out is to lose consciousness or to faint. To burn out is to become very tired and sick from working too hard. A checkup would be a physical examination from a doctor, and out of the blue is unexpectedly or suddenly. It's better to use these natural expressions during your speaking rather than going into terminology like this. All right, ellipsis. So ellipsis means leaving things out. So I'm sure you guys are aware about formal and informal English. Like, for example, when we text, that is informal English. So let's just take a look at a few examples. So yes, in formal English, they would say, I'm fine, thanks, and how are you? So informal English would be fine, thanks, and you? So it's very cold, isn't it? You just directly say in informal English that, very cold, isn't it? So please try to avoid informal spoken English during your speaking test. So again, these examples just serve as a do and a don't during your speaking test time. All right, pausing. Pausing is really important. You should know when to pause. Uh, as I mentioned before, if the situation is really serious or if the patient is angry, then you try to pause and then you try to collect your thoughts and then you put it out there. So when we write, we use punctuation to show the boundaries between clauses and sentences. Speakers use pauses and join common phrasal chunks together to organize their speech. Now let's look at an example. Now, what is on top here? This is what you're not supposed to do, and this is what you're supposed to do. So let me just read out the example for you. When you say, now with your throat, I've had a really good look inside, and in fact, there aren't any ulcers and there aren't any glands, but your throat is quite dry, and sometimes that can occur if there is a little bit too much sugar in your blood. Please do not do that. So this is how you're supposed to say it. Now with your throat, I've had a really good look inside, and in fact, there aren't any ulcers and there aren't any glands, but your throat is quite dry, and sometimes that can occur if there is a little bit too much sugar in your blood. So when you pause it right, your fluency is better. Your language sounds better. All right. So conjunctions and or but, because basically the connecting words between two sentences, they often mark the beginning of a new piece of information. So they are used by speaker as a simple and efficient way to join pieces of speech into longer turns at talking. So let me just explain it in a little more detail. The thing is, when your sentences are too short, you're using simple sentences. So to turn them into complex sentences, you can use conjunctions. You can connect two sentences by using any of these words. So, and that way you can also, the patient also will not cut you in between because your sentence is not yet over and you're still giving them a piece of information. So it's always better to use complex sentences both in speaking and writing rather than short, simple, multiple sentences. So in this extract, the doctor uses common words and phrases to perform different functions in the talk, such as signaling the organization or maintaining a positive relationship with the patient. So let me just show you the extract. So again, this is a little task. There have been people who are answering. Would anyone like to solve this? Just one or two, just to know that I am being understood. Yes, one is A. When the doctor says, I'm first of all going to, he means to signal the beginning of the discussion. And the fourth one, Anna. So this is B. So the doctor uses the patient's name to refocus the discussion in case the patient is lost in her own train of thoughts. Yes, the third one is G. Now let's discuss as usually refers to the doctor when he's about to discuss a new topic. And the second one, when they say, okay, let's wrap up. So the doctor signals the end of the appointment. That is H. You guys are really good. All right. So let's move on to the next slide. This is a really useful technique in case you want to wrap up your. I'm really sorry about that. Yeah. Shadowing is a very useful technique in case you want to better yourself at speaking. So this is kind of like something you do for practice. So shadowing is a technique for working on aspects of your pronunciations. So when you shadow, you listen to the speaker and try to imitate and repeat what the speaker says as they say it. So you could listen to an example, of an RJ on the BBC radio news broadcast and try to repeat what they're saying. It need not be loud or let me tell you how to go about it. So choose speakers that are relevant to you. So listen to things that are meaningful and interesting. So when it's interesting, you naturally tend to listen to it with all your attention. And try to pretend or say imitate the speaker so that you get your pronunciations right. You get to know how to go about a phrase or a question, the expression, basically. So you can shadow as quietly as you like, or say you can whisper or be loud or whatever you're comfortable with. So practice shadowing with short phrases, longer utterances, and across turns in conversations. You can even use a transcript for the first few times, so that when you're reading the transcript, so that when you're, yeah, reading the transcript uh, and you're shadowing, you at the same time you're checking if you're right. So this is one of the best techniques to improve your speaking because you tend to pick up on words, accents, and expressions. So here are a few phrases. Again, I do not advise you by heart this, but this is just for your reference. There's only an example. You could take a screenshot if you like, but please do not by heart it. I'm pretty sure these are all like general phrases. Just make sure that you're aware of these questions because in these phrases, one question might be phrased in 3 to 4 different ways. But when you're actually going through the speaking test, you might panic and you might start using, the same question over and over again, or the same form of sentence over and over again. So this is just to avoid that, because when you have an idea, it might click at the back of your mind and you might end up using these sentences. Then there are these. Which brings us to the end of this session. How can we help you? We can guide you through your OET journey. We check your speaking by conducting individual speaking sessions and help you get the desired grade. To know more, please email us at oet@aspiretoblab.com. Thank you so much for attending the webinar. We hope this session was informative. All right, so all right, so the next speaking session will be held on the Wednesday, on the 17th of June at 9 a.m. UK time. And during that time, I will be summarizing whatever I have taught today in the shortest form, because I know this was a lot to take in probably. And we will pick 1 or 2 candidates, say from your side as well, and then do the stations. And we will also be, enacting 1 or 2 tests before that, so that you guys get a complete idea as to how a speaking subtest goes. So yes, interested candidates, do drop us a message or an email and we will send you the link. So Let's address the questions. So I can see that there have been a lot of complaints regarding the sound and the pause video. I'm really sorry for the technical glitch. That's something that we really need to get ourselves around. All right, how to ask the name of the interlocutor while the setting is home visit or accident or trauma or emergency. Usually it will not be an emergency room kind of a situation. It'll not be an accident or a trauma. Yeah, home visits, usually when it comes to nursing, and hospital settings when it comes to medical doctors. So usually what happens is that the interlocutor introduces themselves, or even if they haven't, you can always, ask them again, saying, I'm sorry, I didn't get your name, or just initiate a conversation and do ask their name. And most of the times you don't have to address them by their name. It depends on the task again, but in case you don't and the interlocutor has not introduced themselves, you can go ahead and ask. There is no restriction. So how to answer if he's reluctant till the end? He will not be reluctant till the end. They want to check your language skills. So the more you talk, that's how they can assess. So usually it'll be a friendly patient, somebody who wants to talk and who is, very open to information gathering. So yes, he will not be reluctant until the end. Usually it is not an angry patient or somebody who doesn't talk, because then there would be no purpose, right? Because they're testing your language. They need you to talk. Or even if they're quiet, you try to initiate the conversation. You frame your questions differently. Just keep asking, keep probing. Right, I've seen a few responses. Hi, Jack. I'm Debbie, and I'll be your doctor today. Yes, that's good. Hi, Jack. I'm the nurse who will be attending you today. Hello, Jack. I'm here to help you. At the same time, you know, give your name, introduce yourself. Do not make the mistake that I did during my first webinar where I forgot to introduce myself. Please always give your name and then say why you're there or what you're going to do next. Should I express myself like in the patient role? You will not be, in the actual speaking subtest, you will be playing the role of the health professional, and the interlocutor is always, always, always the patient or the patient's caregiver. So you will not be, what do you say, playing the role of a patient. Signposting. Signposting is, say, when you're taking the history. That's what when it's more of a warning, or say you're tagging the next set of questions under a heading. So you're labeling them, and then you ask them regarding it. That's what, say, can I know about I'll be asking you a few questions about your past history, and then you go into questions regarding those. So you kind of give it a heading and then you ask the questions under it. Can we ask the interlocutor name before starting the role play? Yes, you definitely can. All those who have attempted the little tasks and sent their answers, really good going. Thank you for doing so. Is the Wednesday speaking session free or paid? It's for free. It's as of now, we are conducting free webinars. So it'll be, let me just repeat the time and date again. So it'll be held on the Wednesday, that is 17th June at 9 a.m. UK. So that is 9 a.m. BST. So will this be safe to watch later? We are currently figuring out a way to do that so that we can send it across. Yeah, so let's see what can be done. So is there anything that you guys didn't understand or any concept that you want me to go through again? Please let me know. How can you listen to the session again? Yes, as I just mentioned, we are trying to figure out how to record this session and send it across to people so that it's useful. So do you guys have any more questions? You can always get back to us on our email handle, oet@aspiretoplab.com or info@aspiretoplab.com. And we also have a dedicated WhatsApp group chat for OET. The number is +918105966999. And we have our Facebook and website handles on the screen. So the Facebook group handle is Aspire IELTS/OET, and you can find us at oet.aspiretoplab.com. So any news on the OET home test? As far as we have heard, there will be a trial by this month end or sometime soon. And only when it happens can we give you more information, because that is when even we'll get to know as to how it works and what's happening. So hopefully I was not too hard to follow, and It might seem like a lot of information, but if you actually collectively look at it, it's kind of not. It's just, just bear this in mind. That's all. You don't have to exactly remember all of this. This gives you like a general idea as to what exactly happens and how the, uh, how it's assessed. All right, then let's wrap up this session. No one has any more questions? Even if you do, you can always write us an email or drop us a message on our dedicated WhatsApp group. So yes, thank you so much for attending this webinar. I hope it was informative and useful. All right. Good night, guys.